Well, good afternoon. Oh, wow, that is quite the loud voice here. Good afternoon, everybody. I should talk quietly while they dial me in here. Good afternoon, everybody. Thank you for joining here. I recommend that you move up to the front 2 rows. Be assured that we will not call on anybody to do a dance or answer a question. But you can see the slides a little bit better if you're sitting a little bit further, as some of you may have noticed during the luncheon. I think there were some slides that were a little bit harder to see, though we try to use no font under 30 points. So my name is Christian Laster. I'm the founder and CEO of Ingenium Digital Health Advisors, and it's my pleasure to introduce here Dr. Jim Worth, who is the CEO of Tri-Area Community Health. As Kathy explained this morning, if you want to read his bio, you can do so in the app. And without further ado, we're going to dive right into how to start and maintain organizational transformation. So please join me in welcoming Dr. Jim Worth.
Thank you. Thank you, everybody. Appreciate that. And thanks for choosing us this afternoon. I'm going to speak for the first half. Christian's going to speak for the second half, and we're going to combine questions and answers at the ends of each of ours. So please put some things in the chat or be ready to ask some questions as we go through. Let's see. Go. All right. Conflict of interest. Neither of us have anything to declare. And so I'm going to just spend a few minutes on this slide before working into the meat of the matter. Tri-Area Community Health, we're a federally qualified health center in Southwest Virginia. We have 5 sites right now, 4 full-service sites and 1 behavioral health site. We have strength in primary medical care, behavioral health care, pharmacy, and we're in very, very rural. There's only one town that we're in where there's any immediate competition from a hospital-based system. Everywhere else, it's 15 to 20 miles to our next competitor. And so that's the reality of the life that we've been living in since the organization was founded 40 years ago. This summer, I had the opportunity of being UCLA has a healthcare leaders program, and I was accepted into that this summer. And as part of that, we needed to come up with a project. And so they gave us all these things to look at in order to come up with our project. And as I started looking at what the healthcare environment is and what it looks like it's going to be in the future, I got pretty concerned about whether we would be in existence in 5 years. When I started looking at who is coming into our space, we went from no competition to a lot of competition as a result of COVID and because of the digital world. And so as part of that sort of fear about what was happening, I contacted Kathy Wibberly from Matrix, and I said, I really need some help in thinking about what the future looks like. And she said, that question is coming up a lot around federally qualified health centers because health systems, and some of you may be from hospital systems, you all have lots of money to be able to, and people to be able to look at those kinds of things. As a nonprofit, small nonprofit, we're just barely have enough people to do what we need to do. And so Kathy said, there is a movement to start talking about the health center of the future. And so that started me thinking about what we would need to do as an organization and decided that I said, well, what the heck? This is the new vision for Tri-Area. Tri-Area will be the model health center of the future. In a few years, when somebody says, who's doing health center, who's the top health center, who's doing technology well, who knows what's going on and is at the leader of the pack, they'd say Tri-Area. That's my goal. That's the vision. So now, how are we going to get there? Where are we in the process? So right now, we're a health center. We're a decent health center. I got some colleagues on the call and online, and they'll agree. Our numbers are not spectacular at this point, but we will be. We will have spectacular numbers, and we also will have figured out how to incorporate technology down the road to maximize what we do and how well we do it. So here's how the journey started. I first had to convince my board they actually took very little convincing. When I just started laying out what I'll lay out for you here today, they were immediately said, yes, we need to change. Went to the senior leadership team, laid out what I'm going to lay out for you here today. Yes, immediately, there was no disagreement. We need to change. We all want to keep our jobs. We want to continue to help the thousands of people in our communities. So the biggest thing was to get the other 130 people in the organization on board. And so we had the opportunity in August, had already decided to convene an all-staff gathering where everybody in the organization was not part of Health Center Week, so we were all coming together already. Decided to add start doing some data gathering, asked the staff to do a SWOT analysis, strengths, weaknesses, opportunities, and threats. What you'll see here are the top themes for the threats from the staff. This was not me feeding them this information. This is what the staff came up with. The staff said, and this is in order, actually, this is in order. They said, big chains offering telehealth and or urgent care is the #1 threat to us right now. I agree. I didn't have to say it. They said it. Insurance companies, we talked about that previously, decrease in reimbursement. For those of you who know 340B and how important that is to the well-being of nonprofits. Hospitals and their outpatient practices, bigger clinics in the area, technology concerns, and the final one, again, from the staff, not changing. That was one of the biggest threats to us as an organization. So that then allowed me to just build off of this in terms of thinking, where do we need to go from here? And here's what I laid out for them in this gathering that then I think helped lead to some of the data that you'll see here in a second. So we're in a rural area, and those of you who are in rural areas know that rural areas, even if you look at what happened during COVID, where they say people moved to rural areas, people really didn't move to rural areas overall. There's a population decline in almost, if you look at all the statistics in rural areas. Either people are moving out, young kids, the youth are moving away because they don't see any opportunity. The older adults who are staying there, who are aging in place, are dying and nobody's moving in to take their place. So we have population decline. We also have, I see there's a range of ages in the audience. I think there's no surprise that the current generation of folks have a different view of healthcare from the long-term folks who we have, where it's about immediate access, not having a long-term relationship. In fact, just have an anecdote from last night where I was talking with a colleague who has a child who lives just down the road, or who works just down the road from one of our clinics. And she said to him, well, you should go get your health care from Tri-Area. They're just down the road from you. And he said, I'm too busy, and I just want to get it done. And it's so easy just to get on my phone. So she works in healthcare, and she's advocating that he go just 2 minutes down the road to our clinic to get healthcare, and he says it's too much bother. I'm just going to use my phone. That's what we're facing with this generation, with immediate access and with telehealth, with the fact that access is there. Telehealth we all know about, emerging competitors. Everybody's heard of Amazon. Everybody's heard of Walmart. Everybody's heard of Dollar General. That's our new competition. It's not just this hospital with one clinic in one town where we work. It's multi-billion-dollar organizations. How are we going to compete with them? Insurance company decisions, virtual care first, you all probably have heard about that, where insurance companies are saying we're not going to pay for in-person care unless you've tried virtual care first and decided that that's not going to work. That's the decisions being taken out of our hands. Urgent care, here again, it's that immediate response. I don't care if I see the same person every time. I just want to get the care for this problem or that problem. I don't need a relationship. And then here again, the threats to the 340B. For those of you who don't know 340B, that's around medication, the cost of medication, and it benefits organizations like ours and critical access hospitals in order to be able to provide medication at a lower cost. So that was what I told my staff. I said, these are the threats that we're facing. This is the concern that we have. And so this is what I said later. I said, obviously healthcare delivery is being reinvented in terms of what's possible and what's expected. We want to continue to employ all of you. We want to continue to provide service. We want to expand services. We want to do more. But if we can't compete, we won't stay in business. And if we don't stay in business, we can't help. So we have to figure something else out. We have to change. And so that's when I said we are going to be the model health center of the future. And here's the argument for those of you who are trying to, looking at your organizational change. This is what I just said to them. And they could all buy into this because who doesn't want these things on the left-hand side? We want to continue to provide good pay and benefits and employ the staff. If we want to do that, we have to evolve. If we want to enhance or increase our services, we have to innovate. If we want to continue to exist, we have to transform as an organization. And because, remember before I said that Matrix was talking about this health center of the future? Built-in consultation opportunities with Matrix, so we need to do this now. We can't wait another year if we're going to do this. So last August, boom, we are going forward. At the same time, met Christian and his colleague Kathy, and who were working with Matrix, and I said, we can't do this alone. I mean, I'm a psychologist, I know about organizational change, but I'm in the middle of it, so gotta have somebody else from the outside help. And so that decision to bring in the organizational consultants and give us a different perspective has helped us through the next few steps. So initial steps, no problem. Everybody seemed to be on board. So now we're maintaining the process through having regular progress updates. I update my board every month on where things stand, what we're doing. Have deliverables that I'm providing them in terms of next steps along the way. Every week I've continued to update the leadership team, and with the staff motivation, we're doing the Olympics also. So every 1 week I do an Olympics update with trying to do team building across the organization, and the next week is a vision update. So every other week they're getting a vision update on what we're doing as an organization, what we've accomplished in the last couple weeks, what's coming forward in the next few weeks, so that they can feel like they're a part of things. And then we have really tried to increase our listening to staff and you'll see some of the data coming out of that here soon in the next few slides, but also by visiting the sites on a more regular basis and having our leadership team go out and meet with, especially with the medical and behavioral health providers, so that they feel like they're bought into the system. The board did update our mission, vision, and values and our strategic plan, and so now everything is built around the strategic plan pillars that you'll see here in the next second. But that showed that as we went down to the basics, I mean, even down to the mission, we changed the mission based on feedback from the staff and from where we needed to go as an organization. So here are the data. Christian and Kathy, as outsiders, collected some data, did the survey, and here are the responses. So how excited are you about contributing to Tri-Area becoming the model health center of the future? So you can see this slide, but this also slide provides a little bit better picture. Within weeks, within just a couple weeks, I think it was 3 weeks, within 3 weeks of when I said we are going to be the model health center of the future, 88% of the staff who responded to the survey said that they were excited or very excited about being part of that process. Now, there was one person who said not interested and a few who were neutral. If you heard Dan Weberg earlier that he talked about the laggards, and don't go to the laggards, go to those who are excited. So we're just moving forward and we're paying attention to those who are excited. And those other folks, if they want to come along, they can come along. If not, we'll see what happens down the road in terms of whether they think this is the right place for them. They also asked, what do you see as what are the 3 biggest results of us becoming the model health center of the future? And so the first one is attracting and keeping well-qualified staff and clinicians, making sure we have the financial means to stay in business, and then 3 more that were right in the same area with effectively addressing all factors that impact health and well-being, offering new medical and clinical services, and consistently achieve excellent health outcomes for our patients. That last one, I'm going to come back to because that's been a driving force here after we saw some other data that we had. So this is the model that Christian and Kathy sort of helped us develop as we thought about our organization. We want to be have an exemplary, sustainable team who are lastingly transforming community health. And as part of our revisioning of ourselves, we redid our strategic plan and we came up with pillars. Many of you, these probably will look familiar if y'all have done, talked about pillars. So these are deliberately in order. Community, when we asked the staff about why they worked for Tri-Area and what they wanted to do, community was always the first. It was the strongest thing that came up, so that's our first pillar. Maintaining and increasing access to our services, improving quality, providing a good service experience, being a good place to work, and staying in business. Those are the 6 pillars. Here again, those are developed out of some of the feedback from staff. And then there's a whole theme around high performance organizations. And so there's some research around that. And so that's sort of our undergird. And then there's a number of different skills that we as an organization didn't quite have that we need to build on and develop. And so one of the ones that I'll just focus on is data-driven decision-making. Last year at the gathering was the first time we shared financial information with our staff. And so they don't know where our money comes from. They just figure the grant covers everything. It doesn't matter what we do in the clinics. We have this grant from the government. When that's not the case. But it's not their fault that they didn't know that. We never told them. And so that's one of the things that we're really focusing on at this point. 5 minutes, all right. So we have a bunch of initiatives that we have talked to them about. And Christian and Kathy surveyed staff. We had already started doing some things. There were maybe not 1,000, but it sure seemed like 1,000 ideas that the staff had for what to do. And so we just had to figure out how are we going to take all this information and take these ideas and these concepts and then come up with some initiatives. And in order to do that, we decided to use our 6 pillars. So the 6 pillars from our strategic plan, and then those foundational capacities in the orange bricks, whether or not something had high value or return on investment, and then how difficult it would be to actually implement. And our leadership team went through a process and scored these on a 1 to 9 scale, and came up with what are we going to do and in what order do we want to try and do these things as we transform as an organization. There's 3 real themes to what we were looking at, and then 1 overall piece. And so I'll just, for the sake of time, hit these real quickly. Far and away, the number 1 that came up in terms of our priority was optimizing telehealth. That's a digital health thing, but it also involves our services. We have a mobile unit, and so we need to use that more. And so that is a new enhanced service, but it also affects telehealth because we want to use telehealth in that model. We have some same-day access, but we need to do more. We want to do more. And then there are several that relate to value-based care. I'm sure many of you are looking at or are already involved in value-based care. We are working with an ACO, and so several of these in green relate to what that ACO's priorities are and that where there's shared savings involved. And so we were already moving those directions, so it made sense that we would put those higher priority. And then we have these major overall management for our leadership team and are working with our middle managers to try and change as an organization to, here again, better embrace the change. And so we have focused on the 2 major initiatives that we're doing right now. One is optimizing telehealth services, and the second is fact-based management. And I can talk more about those if we have time in question and answer, but we're really trying to focus on using data, providing data, leveraging data, so that, and when people ask us questions, then we can have the data to say why we're doing things in a certain way, as opposed to, it just seems like the right thing to do. Well, it seems like the right thing to do for these reasons. And then we're opening a new site. We want to talk to employers more, talk to schools, increase our pharmacy capture. And then dental services, we contract out for dental services. It's lowest on here, not because it's lowest priority, because it's the hardest and most expensive thing to do. So if it was not for some of those other criteria, this would be one of the higher ones, but those of you who have dental know that it is very difficult if you don't have some funding for it. So as I start to transition over to Christian, this is just sort of this roadmap that have been working on. We're in the midst of doing these different initiatives, so this is just sort of generic language here. But the main thing is that as we move forward in this transformation process, we're building off of what we had before. And what we had to begin with was the buy-in from the staff. If we didn't have the buy-in from the staff, we'd be at a very different place at this point. It would have taken a lot more work to get to where we are now. We're continuing to have consultative support. We've got a number of different things going on. We're trying to do leadership development and coaching for both our senior leadership team and our middle managers. We really hadn't done a really good job with our middle managers. And so they are the bedrock of the organization. So we realized that we needed to do some more for them. And then we're also trying to utilize subject matter expertise both with our consultants and with others across Virginia who are ahead of us in some of these areas so that we can continue to learn from others. And with that, I'm going to turn it over to Christian and be happy to answer questions if we have time later on or to step aside afterward. Thank you.
Great. Thank you very much. I could get a microphone. Thank you, yes. And we'll be back for Q&A. So what I liked about this and why we were excited of putting this back to back with Dan Weberg's presentation, if you were here early, is that really Jim exemplified kind of what Jim was talking, what Dan Weberg was talking about. You create a vision first, right? And you create an outcome. You paint a picture of the future, but then you also need to give the environment and provide the environment how to do it and prioritize your initiatives. And so that was about starting, and then maintaining is just, well, you just got to keep your eye on the initiatives that have now been launched, that are on this roadmap, that have been sequenced, and so there's leaders in the organizations that are the leads and the sponsors of the different projects. So that's how it's being maintained. What we wanted to add here to this presentation is an outlook of what does an organization look like when they stay the course on this transformation. And so I just brought a few examples here from organizations that we are aware of that have done an extraordinary job. This is an organization in Vermont here, Community Care Network, a behavioral health organization with over 400 employees, over 25 different services in a rural community. And 10, 12 years ago, they were closely scrutinized by the regulator. And so they transitioned from this closely and almost losing their funding because they were not performing to now being an organization that every year sets a strategy and consistently in the last 7 years has met their goals. They've set some ambitious goals and they have met them and really engaged the organization and now building on that success. They're using data to improve on it, and they also integrated, they were dabbling a little bit in telehealth before in COVID, but they really doubled down on optimizing their telehealth and having now a hybrid care environment in which they do group sessions and virtual sessions. Another one, also Kathy, my colleague, is from Vermont, and so she has access to these organizations. And so that's a regional medical center, which also was being averaged by any means 20 years ago. And then they decided, we want to become the best community health system in New England. And so that was a very ambitious, very motivating goal. And then they worked very hard for 5, 6, 7 years and got some accolades, got the, I think, Magnet recognition, Magnet designation for nursing excellence. They applied for the State Baldrige Award, used that as a framework to get to kind of shepherd that. And so that is what's possible. But it's all started, as Jim illustrated, with a leader at the top waking up one morning and saying, we want to become the model health center for the future, not just a great health center, but become the model health center where other organizations can get inspired, because that's what inspired him, and that enthusiasm he has now transferred, as we saw in the survey, to the staff, where 88% were excited or very excited. And so that was great to see. Another organization, a health system in Texas, also facing a rural organization. It's an organization I worked with. And they really systemated their strategic planning. They actually created a new position of somebody being in charge of strategic planning. There was a new CEO that came in, and they just have all these accolades here that are pasted there that they have on their website, and they created really a culture change around some cute acronym of Be Wise, but it's like it's embedded in everything they do, and they have dashboards in the meeting rooms. There's a dashboard printout of the latest monthly report of the numbers. Just like Jim shared, right? This was the first time that somebody had shared some financial numbers with the staff. And so that's what it takes. It's data-driven, it takes leadership. Also, they really pivoted in making telehealth an integral part because they also saw the competition and the need out there to serve these patients. R-Care is another organization, large FQHC, but 20 years ago, they had 4 locations. And a colleague of ours worked with them over the last 20 years through a number of involvements and HRSA programs. And now they're HIMSS stage 7, and they worked on Baldrige 10 years ago, then the Joint Commission accreditation. So they really have taken the community health center to the next level, and have now a high-performing organization with great staff that are wonderful to work with, that are very collaborative. And so it's this culture that really changed in this organization. And then one of the flagships, if you never heard of them, they're fascinating to study, South Central Foundation in Alaska, I think a 2-time Baldrige winner, 2011 and 2017. And Don Borwick, who is one of my heroes of healthcare improvement, he started the Institute of Healthcare Improvement 22 years ago, and was also the administrator for Medicare and Medicaid, I think 10, 12 years ago. And he said, I think it's the leading example of healthcare redesign in the nation. And South Central Foundation have also now started as kind of a separate, I don't want to say consulting firm, but it's a separate organization where you can go to and you can be involved in workshops and in annual conferences to learn from them what they have learned in their organizations, how they changed the culture and how they served a definitely highly rural population, and also with the indigenous population. So, and you can see on what they put on their website, because that's where I pulled this from, they're very, very data driven, right? And they're looking at ER decrease in patient discharges and HEDIS and employee satisfaction. I mean, so they're constantly measuring that, which is also then the theme of our next presentation. So we just wanted to bring you that because, but you got to start somewhere at the beginning, and it starts with an idea, it starts with communication to the staff, it starts with engaging and empowering the leaders in your organization, and you got to crawl before you walk, before you run and jump and soar. And I'm excited to see Jim stand up here on the stage in 3-4 years, so we will see, and present that, yes, now organizations are stopping by Tri-Area Community Health in Southern Virginia to study the journey that they have been on to become the model health center of the future. So so you need to retool. And I'll just skip that. So we already talked about that, and then I wanted to skip that slide too in the interest of time. So now we want to open it up for a few minutes of Q&A. If you have questions, especially for Jim about this journey, be happy to have a conversation here. Also, if you're virtually online, go to the Q&A tab and post your questions there. Then we'll have a few slides to wrap up our presentation. Thank you very much. Any questions for Jim? Yes.
Excellent presentation. I didn't know I was sitting next to such a brilliant guy this morning at breakfast. Well, how long's the journey from start to finish? I missed the beginning, so maybe you covered it.
So it was in June that I started thinking about that I started getting concerned. I will be honest. I'd heard that Walmart was doing some stuff, but I really didn't pay a whole lot of attention. Then when I started doing that environmental scan, it's like, oh my gosh, where have I been the last year or two? What's happening out here in the world? And then with COVID, of course, accelerated everything. So June, I talked to Kathy and had this idea for the Model Health Center of the Future, talked to the board in between and the leadership team in between. August, presented it to the staff. End of August was when the staff seemed to be bought in. And so then we've just been on a rocket ship since that time. had already thought about having a telehealth coordinator, but was thinking more in terms of operational stuff. Since this happened, we have totally shifted, and she's working with Christian to optimize telehealth across the organization in a broader scheme, thinking about working with EMS, working in the schools, remote patient monitoring, all those different things that weren't on our radar before. In terms of when it'll be done, I'm ready to move on to the next thing, but I think it's going to be another year or two before we'll start seeing some real changes in our data and so forth. I mean, we're doing some rapid cycle improvement projects right now that hopefully our UDS numbers, for those of you who know about UDS, the numbers that we report to the government hopefully will be improved in the next 3 months. And then we'll continue to improve, but hopefully in the next year we'll have stood up some more services, some digital services, expanded our current portfolio, and be able to basically say that what my goal is that that person who says I'm going to get my health care through virtual care and will be disappointed when Walmart says, sorry, you got to see somebody in person, go find somebody. And instead, if they connect with us, we can say, oh, we need you to go see somebody, and your record will be waiting for you with our healthcare provider down the road. So we can offer everything. We will be in a both and, hopefully in the next year or so, where we can compete with Walmart, we can compete with urgent care, and and our numbers will show that the bricks and mortar care that we're providing is superlative. Right now, the numbers don't show that, but hopefully by the end of this year they will. But Christian has told me that, and Kathy has told me that I have to stay the course. I can't get distracted and think about the next thing. I got to stay the course with this, and certainly the leadership team support them as they continue to work with everybody over the course of the next few years. Hope that answered your question. Do we have anything from the virtual group? Okay. The other thing that I'll say is when I thought about coming up here, I really didn't think that I should be here, because I don't think that, and I hope my colleagues don't take offense to this, but I really don't think we're anything special. I mean, we are a health center. We're just a health center. So it's not like we aren't the South Central Foundation, but what we talked about is the main thing is to get started. See that there's a need and get started so that you can move forward. Because otherwise, here again, I really think that we would not be here in 5 years if we didn't change. And so for those of you who are in organizations where you're trying to figure out what's next or should we do something, just open up and take a look at what Dollar General is planning on doing. 70% of the population lives near a Dollar General. 90% of the population shops at a Walmart at least once a year. So that's the competition. Everybody buys on Amazon. So, well, not everybody, but you know what I mean. So that's the competition. Can you give us a sense of the patient's response to your initiatives? I don't know that the patients have seen it yet because it's more internal. It's more a matter of this is our attitude, this is what we're doing. We're trying to do some things with our measures and the care that we're providing, but we haven't rolled out anything new. What they may have experienced is perhaps, I would hope, at least some difference in the attitude of staff in terms of how we're interacting with them. We really haven't focused on that piece yet in terms of service experience and doing sort of the Disneyfication or the Chick-fil-A approach to service. We haven't got that far yet, but I hope that they are feeling good when they interact with our staff. Next year, maybe we'll have some data that will tell us what the patient's responses are.
We'll certainly have some data next year.
All right.
Because data is key. And yes, that's an excellent question. The initiatives that you saw on the roadmap were kicked off 2-3 months ago, right? So we're really at the very beginning. And the idea was born last fall, was kicked off, and then we did the planning over the winter, and then really at the beginning of this year started kicking off the initiatives. But yes, we're going to keep an eye on, and we're rolling right now, looking at all of those 6 pillars and identifying the key performance indicators, the key data points to measure, so that yes, next year when Jim reports on that, then we can show the impact on the staff satisfaction, on the clinician satisfaction, on the patient satisfaction, on the quality data, and ultimately, which what prompted this, on the financial sustainability of the organization, so that there is high confidence that it will be around in the next 5 years and actually in the next 15 and 50 years. So good. I think we have a couple more slides, and I think actually those are yours. So if we could switch back to the presentation, and then we'll advance the slide. I think the first is a prompt actually for you here. So is how can your organization continue to prepare for the future? If we could get the slides back up here. I don't think you don't have the magic wand. I think I think it's the man behind the curtain in the back that has. There we go. All right. So well, why don't you take us home here on that summary?
So just to summarize. At least from our perspective, the one thing that you want to do if you want to lead this transformation process is to create a compelling vision. BHAG is Big, Hairy, Audacious Goal. That's the official language to use that I've learned from these leadership things is BHAGs. So create a BHAG and get people bought in. From my perspective, my experience, it doesn't do any good to sugarcoat things with the staff. I mean, let them know what the threats are, let them know what's real, let them know, we want to keep you employed. I don't want to scare you, but we can't keep doing this and keep that happening. And of course, engage the leadership team in the process along the way. I mean, this is not, I sort of said this, but it wouldn't have gone anywhere if the leadership team had not been on board. And to a person, they all, I only had to say a couple sentences and they said, yes. How do we start? So I really have to give them a lot of credit. The board of directors they didn't take any convincing, but it takes somebody to say something, but then it takes a village to build it. In terms of maintaining momentum during the change process, it goes back to the communication, showing the progress, collecting the data and showing the impact. And then we didn't talk a lot about it, but all these initiatives, instead of my being in charge of everything, there's delegation with the leadership team and middle managers and others who are sponsoring these and being leads in the sites for these different projects so that it's distributed. And more people are bought in because more people have more responsibilities. Anything you wanted to add?
All right. And with that, we thank you very much for your attention. Jim is available for any other additional questions. And I hope you'll stick around for the next session, where we'll also have a CEO of a community health center talking about how he has integrated data-driven decision-making into his leadership process. So thank you very much.
Thank you.